The Gospels gives us a rich account of the role of healing in the life of Jesus. Jesus liberated everyone from sickness who came to him, motivated by his compassion and faith of those who believed that they would be healed by him. That same compassion and faith are there for us too. The faith of others was significant in harnessing Jesus' healing power and inspiring strength for our own faith. Hello and good day, everyone. I am Dr. Annalie Jane Red Celocia, a family and community physician from Cebu City, Philippines. I also teach in one of the College of Medicine here, and I take care of the community medicine rotation of senior clerks. Before I go deeper into my topic on bringing Jesus' healing grace to families and communities to promote health equity, I'd like to share first why I chose this field of medicine. Being a doctor, I believe, is not just mere profession, but a vocation, a calling. And when I decided to take this path, in spite of my initial reluctance, I strongly felt being called to work not in the corners of big hospitals, wearing a white coat and stethoscope around my neck, but in the communities, working with people in the grassroots level. Health, which is defined as not only the absence of disease or infirmity, but the condition that enables a person to live an economically and socially productive life, is a human right and is inseparable to our dignity as human beings created in the image and likeness of God. However, not everyone has the capacity to access resources that will maintain their health throughout their lives. It is even said that until now, 60% of Filipinos eventually die without being seen by a doctor, without access to proper health care. It is for this reason that I chose to be a community physician and be a staunch advocate of primary health care and public health. Now, let's talk about the pandemic. The pandemic has caused so many lives to be lost. Just not just being infected by the virus, but by the impact caused by the pandemic on an ailing healthcare system that is very much focused on curative care and not on preventive and promotive care, which are actually the main focus of primary health care. People who were sick, not because of COVID, but of other diseases, were somehow set aside and neglected because the health sector was focused so much on mitigating the pandemic. Although it is really needed, but you know, it had a bigger impact also on the non-COVID cases. People too were afraid to have medical checkups for fear of getting the infection, and not to mention the difficulty of access due to cyclic lockdowns. That is why, at the start of the pandemic, being a community physician, we really tried our best to educate families and communities on the importance of strictly following preventive measures such as proper hand washing, proper cough etiquette, physical distancing, proper wearing of face masks and face shields, and the use of alcohols, hand sanitizers, and disinfectants. Now, in one of these occasions of giving health education in the community, a mother of seven whose husband is paralyzed and bedridden commented in Cebuano dialect, Doc, I only earn a living by doing laundry from neighbors or segregating tin cans and bottles from garbage collected in the neighborhood, which I sell. In most days, I only earn 200 pesos, which I usually spend for food so that at least my family can have one decent meal a day. We cannot afford to buy soap, much more face masks, alcohol, and hand sanitizers. If we will prioritize those, my family will die of hunger and instead and not of the virus. This legit and sincere concern of that mother opened my eyes to the reality that yes, we are all in this pandemic, but no, we are not in the same boat. Sometimes it's easy for people to say, oh, we must observe physical distancing. But how can it be done if a family of seven lives in a 3 by 3 meter house? Or is it, it's easy for some people to say, just stay at home and watch TV. Okay. When there are families who direly need to go outside their homes to earn a living to be able to put food on the table for that day. And you know what? Much of the pandemic response happened in tertiary hospitals. However, experience and statistics tells us that most COVID-19 cases are actually mild or they have mild to moderate symptoms, and sick members can actually be taken care of at home. Therefore, I believe that the home is the real front line. Thus, there is a need to increase the resilience and response capacities of families. Since different families have different capacities to respond to a stressful life event, such as COVID-19 pandemic and its accompanying socioeconomic impact, it is important to assess and identify the level of risks of families, which are influenced by family structure, functionality, home conditions, and the presence of intrafamilial and community resources. Families' preparedness to respond is dependent on the level of guidance and support that they receive from the community. That is why, in order to address these important issues, our institution developed ways in order to reach out families, in order to guide and help them, most especially in their medical concerns. We established a telemedicine platform in collaboration with the Department of Health to provide patients and families to seek free medical consultations online or through phone, thereby making consults possible at the same time minimizing the risk of exposure to the virus. We also had what we call family telehealth education in lieu of our face to face home visits in order to properly assess families' risks and educate and guide them what to do in case a family member gets infected. And when we were allowed a limited face to face interaction with families, we conducted home visits. Each group of medical interns adopted families to be enrolled in our intensive family healthcare program, whereby they help and guide the families with urgent medical concerns through the healthcare system through proper medical management and referral. We used what we call a PFC approach. It means patient centered, family focused, and community oriented approach. For a patient centered approach, we do not only look into the medical history and physical examination of our patients, but we also take into account their own understanding and experience of their illness. We try to analyze if there are misperceptions or belief systems that have affected the patient's understanding of what he or she is going through, thereby affecting her health seeking behavior. After guiding them what diagnostic laboratories to take, we manage them not only medically, but we also emphasize a supportive management, self care, preventive measures, and proper health education. Since we believe that the disease of each patient as a member of a family will always have an impact to the other members, we also do the second component, which is the family focused approach. In order to assess the impact of the patient's disease to the family, we use some tools to analyze family structure, dynamics, and function in order to predict some behavioral patterns and identify responses that might be detrimental to the rest of the family members. We also look into each of the family members' thoughts, experiences, and emotions through family counseling methods. And if they have problems with sustaining the medical management of their patient, we help the families start their livelihood projects so that they can have an extra income that can be used for their medical needs. In this way, families are being empowered to be accountable to their own healthcare, especially for their sick members. Lastly, for the community oriented approach, we look into the social determinants of health using tools like fishbone diagram, nominal group technique, problem prioritization, and the like, in order to create a program plan to address underlying issues or risk factors present in the community that contributed to their problem. If I may quote F. Bauman, he said, "What good is it to treat a person's illness if the person goes back to the conditions that brought about the illness in the first place?" Come to think of it, how can we prevent waterborne diseases caused by flooding if the drainage system is not repaired? Or how can we eradicate infectious diseases as just like tuberculosis or even COVID-19, and emphasizing physical distancing to prevent the spread of the virus or the bacteria, no? When people are living in congested areas and dilapidated houses? Or how can we emphasize on proper nutrition and diet when we have agricultural lands that are affected so much by climate change, or these lands are being transformed into real estates? How can we truly help if we turn a blind eye to these conditions? These things might be beyond our tasks as healthcare workers in the community, but we can still help by bringing these issues to the rightful government agencies and ask help from the non-government organizations so that they can be properly addressed. We might not be able to change the world, but at least we are making the world of our patients better. We might not be able to solve all the problems, but at least we find solutions to some. And for patients, families, and communities who have been suffering for the longest time, a simple act of kindness and charity is more than enough to uplift their hope, their faith in humanity, and experience God's love with them. As we help a boy who had a chronic bone infection walk again by referring him to orthopedic surgeons, or give sight to an old blind woman in having her cataract removed, or help an adolescent girl get out from being imprisoned by her depression of 4 years, and helping the family understand the importance of mental health, are we not also becoming a reflection of Jesus' healing grace, as he himself made the lame walk, the blind see, and brought people back to life? We must learn from Jesus. As Saint Josemaria Escriva said, we should ask our Lord to give us a good heart, capable of having compassion of other people's pain. Only with such a heart can we realize that the true balm for the suffering and anguish in this world is love. Charity. Jesus came to save the last, the least, and the lost. He took upon himself our wretchedness in order to relieve us of the burden of it. He comes to show compassion to those who suffer and are in need. He does not pass by. He himself taught us through his constant example how we should behave towards our neighbors who are suffering. As St. John the Apostle said, "Let us not love in word or in speech, but in deeds and in truth." And just as God's love is not simply an emotion or feeling, but something that leads our Lord to perform deeds that show it, So our love for our neighbor has to be a love that shows itself in deeds. We should ask our Lord to give us a big heart, a heart which is full of understanding, so that we are able to suffer with those who suffer and to rejoice with those who rejoice. We must ask Him to help us prevent that suffering wherever we can and to make us people who live and spread happiness wherever we happen to be. When we help others, we also help ourselves. As Blessed Alvaro del Portillo wrote in one of his letters, works of mercy as well as the relief they give to those in need serve to improve our own souls and those of the people who accompany us in those activities. We have all experienced that contact with the sick, with the poor, with children and adults who go hungry, always means for us as a meeting with Christ in his weaker or unprotected members. And for that very reason, such contact can mean a spiritual enrichment. The Lord enters with greater intensity into the soul of him who approaches his little brothers, moved not by a mere desire of altruism, which is a noble desire, but not one that is supernaturally effective, but by the very sentiments of Jesus Christ, the Good Shepherd and the Physician of souls. End of quote. Let us ask our Lord to give us an ever watchful charity, because if we are to achieve salvation and arrive at our rightful destination, which is heaven, we need to recognize Christ when he comes out to meet us in our brothers and sisters, in the people around us. Every day we encounter Jesus in the midst of our families, in our place of work, and where we are at a given moment. May other people experience the love of Jesus Christ whenever they encounter us as well. Thank you very much for listening to my sharing. And now may I give you a short video clip to show you what we have done in the communities.
I wish there was a way to know you're in the good old days before you've actually left them. Pangandoy way makatandi sa kuwang kahago ug mga sakripisyo ug dapat na unta ko magmalipayon na pan mo at karon di na ko makasabot wa na nag-abot ug wa na ko kabawon saon angay baba ko nga mo padayon sulbong paunahan ang pantitan akong kauban ipadayon na to atong gisugdan walay pagsulay nga motumbaw puuyog ka na to maski unsa pa na nga kasubo Sa kunsay maabot di ta palupig. Sulbong paunahan, abanti tayo na kung kauban. Ipadayo na to atong gisugdan. Walay pagsulay nga motumba o buuyog ka nato, maski unsa pa na nga kasubo. Gamhanan atong paghiusa, umadaogon kitang tanan. Apan usahay makaluya, salig lang tangan to sa kahitasan. Sulbong paunahan, abanti ta na kung kauban. Ipadayo na to atong gisugdan. Walay pagsulay nga motumba o puyo ka nato,